Let's start.
Good morning. Hi, my name is Kathy Tello,
Nice
and
to
I'll
meet
be
you.
conducting an interview with Dr. Summers here today. She is a veterinarian and a college professor here at Cedar Valley College with the vet technician program on the on-site campus. I'm right now studying to become a vet technician, but ultimately my goal is to become a veterinarian. I will be asking a series of questions just to get a better understanding of the prospective career that I want. Let's just start. How did you know you wanted to be a veterinarian?
Just ever since I was probably 4 or 5 years old, that's all I ever wanted to be was a veterinarian. So it just sort of came. I didn't go through that, I want to be a nurse, I want to be a doctor, I want to be a fireman. You know, I just always knew that I needed to be a veterinarian.
Did you grow up with animals?
We had animals in the house all the time. Mostly cats, dogs, and the assorted rodent. Guinea pigs, gerbils, hamsters, that kind of stuff.
I had rats too. So after high school, what exactly did you do? Did you go immediately into vet school or?
No, you can't go immediately into vet school. You have to do undergraduate work. So I did my undergraduate degree in chemistry because I got kind of scooted out of the biology pre-med bunch. And then I decided to go to graduate school in Ohio for chemistry, got my master's degree, worked for 4 years, 2 years as an abstractor for chemical abstracts, and then 2 years in hematology research with sickle cell anemia.
Wow.
And during that time then I applied to vet school, took the extra courses that I needed, and was admitted to vet school.
Was vet school demanding?
Oh boy. I have had days when I couldn't walk out to my car without, I was in so much pain from being on my feet from 6 o'clock in the morning until 12 o'clock at night.
Is that how long the classes were?
The classes were not so hard. What was hard was the clinical work.
Oh, okay.
So, I mean, it was very demanding.
Was the clinical work the last year?
Last 2 years.
The last 2 years? Is it almost like the doctors where they...
We divide up into 10-week semester or 10-week quarters. Ohio State was in quarter system. So we would do 10 weeks in small animal, 10 weeks in surgery, or that 10 weeks would be divided up. So you'd spend a part of your time, say, in small animal medicine, part of your time in small animal surgery, part of your time in something else, radiology maybe or something like that. So you rotated through all the departments of the hospital.
Okay.
And as a junior, you had a senior over you, and then the senior had a clinician over them. So you got all the scut work, you know, the cleaning up, the running to the lab, that kind of stuff. Then when you became a senior, you got juniors to torture. So anyway, it was fun. I would go back in a minute, but it was very demanding.
Okay. And when did you decide to switch your career path from being a veterinarian back to a professor?
About 14 years ago. I owned my own practice, and I was 50% avian.
Oh.
And I didn't have any emergency clinics to help, so I was on 24 hours a day, 7 days a week. And it just burned me out, so I decided I wanted to teach.
And what made you choose avian, exotic?
I had a boyfriend at one time that raised birds, and I got into it with him, and then I got contacts, and they started calling me, and you know, it just snowballed after that.
So. Okay, and let's see. What advice do you have for students who are looking to follow your career path in the veterinarian field?
Take your studies seriously and make good grades.
How good of a grade?
3.5 or better to even get looked at as an average, grade point average.
And if you have a path that doesn't follow you right, is the best advice, I guess my question is, now that I'm in the vet technician program, I know my classes from before matter, but if I'm a high percentage now in the vet technician program, will they look at that and consider that?
They might.
As me putting a hard effort into
They might, yeah, they might give it some...
Do I have a chance?
Everybody's got a chance. The problem is there's limited number of spaces, and there's usually 10 people for each space. So you really have to stick out as being an excellent choice. out of those 10 people.
And do you advise if you can't get into A&M, let's say Texas, to go out of state? Is there out of states that are a lot easier to get into?
Actually, unless you establish residency, A&M's your only choice. So you would have to move like to Louisiana for a year and then apply, or you'd have to move to Oklahoma, because the vet schools are very protective of their spots, and they only take people who reside in that state. Or some of the vet schools will have contracts with people, with other states, because their state doesn't have a veterinary school.
Okay.
So like if you live in New Hampshire, they don't have a veterinary school, they pay Ohio State to take their students.
Okay.
So.
And let's see, what are your feelings on surgeries, let's say declawing with cats and maybe a flank spay on cats? And
I am not for flank spays.
What is the issue with that?
I just don't feel comfortable doing it that way.
Okay.
And I think that incisions are incisions.
Mm-hmm.
They heal from side to side. It doesn't matter whether they're on the abdomen or in the flank. I just don't like the approach. And I am not against declawing cats. If you don't have to declaw them, it's better if you can train them not to tear up your furniture. But if you have a cat that's very stubborn and still wants to sharpen its claws on all your chairs, I'd declaw them in a minute. I just don't think we have enough pain relieving medications now. We can do it with lasers. We can do small incisions. So I don't think it's really as bad as people make it out to be.
Do they feel pain after?
Sure, they feel pain. We're cutting off this part of their foot.
Do they feel pain years after? Like, does it become
arthritis?
I don't
think so. No.
Okay.
No. The joint's totally gone. I mean, it's cleaned out. So
okay.
There's no arthritis with it.
And going back to your college years, did you ever have an internship?
No.
Never had an internship?
No, because I couldn't decide on whether I wanted to specialize in internal medicine, equine, or surgery. And so I thought, well, if you can't decide, it's better not to commit to one and then have to go back. You have to apply for internships and be accepted by the college. And then if you want to do a residency, there's a matching system for residencies. You put your name in with all the other people who want residencies, and then each college goes through all the names and picks who they want. So you might end up at a school, like you might have wanted to go to Texas A&M for your
mm-hmm.
residency, but the only offer you might get would be from California or from Nebraska or someplace like that.
Oh.
So it's a matching, blind type of matching system.
Okay. And how long did it take for you to actually own your practice?
Oh, how long was I out? I worked for other people for probably 6 years. And then I was helping an older gentleman who owned a practice close to my house. I was helping him out, and he decided to retire, so he sort of sold me his practice for almost nothing.
Wow.
And then I had to build it up, because he had let it go. So.
Okay. Describe one of the scariest emergencies that you had, and what did you have to do?
Scariest emergencies. Well, it was scary for a reason different from what you would think. I got a call one night to go out on a colic on a pony. And this was in Ohio, and it was way out in the country. And I drove up to this place, and there's this Shetland pony, and there's about 10 drunk cowboys around this horse. And I actually was scared to get out of my car. I didn't really know if there was, something going on, whether it was a real emergency or not. So that kind of scared me, and I think that probably was enough of a scare that it ended my nighttime equine career.
Okay. So you also do horses now?
Mm-hmm.
Is that what I'm gathering?
I do horses.
And do you have a practice store, or is it favors?
I'm kind of the barn vet at Buck Branch Farms in Wilmer. So there's about, right now there's probably 60 horses out there that are eventing and hunter jumper and dressage horses.
Aww.
So I do a lot of work on the people that board out there on their horses.
Do you supplement enough income to live comfortably with both your jobs, and were you supplementing enough income when you were just a vet?
When I owned my own practice, I was living hand to mouth. You know what that means?
Yes.
I was
On
poor.
every page.
I didn't get a paycheck sometimes. Everybody else got one, but I didn't. You never knew from one month to the next whether you were going to have enough money. We had to put up with bad weather, like snowstorms would come in and nobody would be in for 2 or 3 days. We had a period of time where we had lost power for over a week because of a windstorm. So you couldn't do anything, just sort of sit around and do nothing. And every time those times happen, you're spending money and you're not making money. So working here provides enough to live comfortably without working extra.
Okay.
I do the horse work because I like it, not for the money.
Okay, good. What are your feelings on being responsible for the entire vet program, the vet technician program on campus?
You want an honest answer?
Yeah.
Every time the position has come up, I have thought whether I wanted to apply for it or not. And I always said no. Because I prefer to be in the classroom.
Yes.
I didn't want to be an administrator. Once we got the reorganization plans done, I can spend half my time as an administrator and half as faculty. That's a lot more appealing to me. So I feel very strongly in providing good leadership, making sure everything gets done like it's supposed to, and that our students go out and are a credit to wherever they go to work.
What are your responsibilities at it?
I do all the scheduling of classes, scheduling of faculty. Right now I'm doing most of Lori's job, the ordering and all that kind of stuff. Counseling with students, advising all the vet tech students, scheduling their classes for them, during registration. God, what else do I do? I get put on tons of committees, for student success, that type of stuff.
Okay.
Just about everything. The only thing I can't do is I can't boss faculty around, which is what I need to be able to do.
Right.
So, but anyway, that's the only thing I don't have to do is boss faculty around.
And almost to wrap it up, I would like to specialize in equine. Do you allow students to follow you or internship with you since you do deal with horses?
I usually tell the students when I'm going to be doing vaccinations at the clinic. Twice a year we do that, and Coggins test in the spring. And any students that want to come over and do, help me out, that's fine.
Okay.
And then we started last year taking our second year nursing students out there for a day for equine stuff, physical exams, that type of stuff, just to get them out. Our horses here are so calm, and they're just numb to everything that they don't act like real horses sometimes.
Right.
So we take them out and let them deal with real horses, the ones that want to stand on your foot and don't want to stand still and that kind of stuff.
Right. Well, I see that you have a long, satisfying career in the animal field here at Cedar Valley, and
it's
also
not over yet.
and in your own practice. It took you so many years to complete your education, and also have had numerous jobs in the fields. Which one do you prefer more, the professor classroom type or the active veterinarian?
Right now, at my age, I like the classroom professor type because I can do that as my job, and then I still have extra time to go out and practice as I want to.
Okay.
So I don't have to depend on people calling me or me going out to live. I can live and still have fun with what I'm doing, and that's the important thing.
All right, Dr. Summers, thank you so much for your time. You have informed me a lot, and to study for my exams, try to make straight A's, be active in the veterinarian technician field and the clubs, or do whatever else I can do. I can tell it's going to take a lot of hard work, and you're definitely a role model for people to follow. So thank you so much for your time, for allowing me to conduct this interview.
Thank you.
Thank you. Bye. Have a good day.